Hi guys, it's me, Professor D, and if you're new, welcome to my channel. If you haven't done so already, please be sure to press the like and subscribe button below. Today I'll be covering the second portion of my diabetes quiz questions. The first portion was the first 10 questions. If you haven't done so already, please be sure to watch the video. If you have, let's just jump into this one. So we're going to start on number 11. So the question is, you're caring for a diabetic patient who's developing a diabetic ketoacidosis. Which task delegation is most appropriate? 1. Ask the unit clerk to page the physician to come to the unit. 2. Ask the LPN to administer IV push insulin according to the sliding scale. 3. Ask the UAP to hang a new bag of normal saline. Or 4, ask the UAP to get the patient a cup of orange juice. And I'll give you guys a moment to think about your answer. And the correct answer, guys, is number 1. What's most appropriate, this patient's going through diabetic ketoacidosis. You're going to ask the clerk, to go ahead and call the physician so you can get orders. And I want to explain to you why the other answers are incorrect. So your second choice was ask the LPN to do IV push. If you guys have not watched my priority and delegation video yet, I strongly urge you to do so. I'd say about 70 to 75% of NCLEX is based on priority and delegation as well as the concept material. So this is something you guys have to know, and it's going to be on your exams as well. So if you're having a hard time with priority or delegation, or you just kind of need a refresher, please be sure to watch that video. So anyway, number 2, LPNs cannot do IV pushes, ladies and gentlemen. Absolutely not. Okay, LPNs, they can give routine meds. They can do IVs. Some states, they have to be IV certified, but most states, they can do IVs, regular IV administration, but never pushes, okay? That LPNs can't do pushes, LPNs can't do blood transfusions. The list can go on. Make sure you watch my video on priority delegation. So number 3, ask the UAP to hang a new bag of normal saline. Absolutely not. CNAs cannot hang bags. CNAs can't do IV infusion or IV therapy. And number 4, ask the UAP to get the patient a cup of orange juice. No! This patient's going through diabetic ketoacidosis. That means that their blood sugar is so high, right? It's so high, the body's now burning off the patient's own fat. Okay, the byproduct of that fat breakdown is the ketones, which is, and by the way, guys, ketones are what? Acidotic, and that's what's making the patient go through diabetic ketoacidosis. So the last thing you want to do is give the patient anything that has glucose, okay? So the correct answer is to call the physician. Number 12. You're serving as a preceptor to a nurse who recently graduated and passed the RN licensure examination. The new nurse has only been on the unit for 2 days. Which patient should you assign to the new nurse? And your choices are 1, a 68-year-old with diabetes who's showing signs of hyperglycemia. 2, a 58-year-old with diabetes who has cellulitis of the left ankle. 3, a 49-year-old with diabetes who just returned from post-anesthesia care unit after below-the-knee amputation. Or 4, a 72-year-old with diabetes with DKA who is receiving IV insulin. And I'll give you guys a moment to think about your answer. And the correct answer, guys, is number 2, the 58-year-old with diabetes who has cellulitis of the left ankle. And let me tell you guys why. Anytime a nurse is a brand new nurse, they just got their license, they're inexperienced. Anytime you guys get a question about a nursing student, right? Or anytime you guys get a question about an RN who's been an RN forever and a day, but they're new to your unit, right? In those 3 situations, you're going to treat those nurses like LPNs, which means you're going to give them the most stable patient. So if it's someone that's an RN, but they don't have experience on your floor, you're going to treat them like an LPN, which means you're going to give them the most stable patient. If it's a brand new nurse who just got licensed, you're going to treat them like an LPN and give them the most stable patient, Or so I gave you the nurse to transfer to your unit, the brand new nurse, or student nurse. If you have a student nurse, you're going to give them the most stable patient. And in this situation, the patient that's diabetic that has cellulitis of the left ankle, that's the most stable. Let's look at our other choices. You have one, the 68-year-old with diabetes who's showing signs of hyperglycemia. Well, that showing signs of hyperglycemia, is that patient stable? No, absolutely not. Let's move on to number 3, the 49-year-old with diabetes who just returned from PACU. No, that's a post-op patient. Do you know how much in-depth assessment goes for that type of patient? They're not stable. So you throw that out. And then you have number 4, the 72-year-old with diabetes with DKA. That is a medical emergency, guys. That is definitely not a stable patient. So the most stable patient, obviously, in this clinical picture is your number 2. So let's move on to question number 13. A patient with diabetes has hot, dry skins, a rapid, deep respirations, and a fruity odor to his breath. As a charge nurse, you observe a newly graduated RN performing all of the following patient tasks. Which one requires you to intervene immediately? 1, checking the patient's finger stick glucose level. 2, encouraging the patient to drink orange juice. 3, checking the patient's order for sliding scale insulin dosing. Or 4, assessing the patient's vital signs every 15 minutes. And I'll give you guys a moment to think about what you think the answer should be. And the correct answer, guys, is number 2, encouraging the patient to drink orange juice. I want you to notice this question's asking which one do you intervene immediately. That's another way of saying which one's wrong. Whenever you guys get a test question and it says, which one do you intervene immediately? Or which one needs clarification, or which needs further teaching, right? All of that, it means which one's the wrong answer. So let's look at the situation. You have a patient that's showing hot, dry skin. Remember what I told you back in the first video for diabetes quiz, right? If the patient's hot and dry, the sugar's too high, and if they're cool and clammy, they need some candy. So this patient is hot and dry. So what does that mean? Their sugar is too high, right? Their sugar's too high. They're exhibiting deep, rapid respirations. And I explained what that was in the first video. That's what's known as the Kussmaul's respirations, okay? This patient's going through diabetic ketoacidosis. So they have all of this acid that's building up in their body, and the body's trying to survive no matter what. So what does the patient start to do? They start to go like this. They're breathing off a whole bunch of CO2. CO2 is what? Acidic. The body's trying to get rid of the diabetic ketoacidosis. That's why they have those types of respirations. And here's your third hint. The patient's exhibiting a fruity odor. What do you think that fruity odor is, guys? All of that sugar, right? So all of those hints are supposed to lead you to let you know that this patient's blood sugar is too high, okay? So it's asking you what is the wrong answer. What's the wrong thing to do? And the wrong thing to do in this situation is to give the patient orange juice. Their sugar's too high. They don't need orange juice. They need insulin, right? So all the other answers are correct, which is, of course, check their glucose levels, and we expect it to be high. 3, check the patient's order for sliding scale insulin dosing because they do need insulin. And then 4, assess the patient's vital signs every 15 minutes. Okay? So let's move on to number 14. A patient has a newly diagnosed type 2 diabetes. Which action should you assign to the LPN instead of a UAP? 1, measuring the patient's vital signs every shift. 2, checking the patient's blood glucose level before each meal. 3, administering sub-Q insulin on a sliding scale as needed. And 4, assisting the patient with morning care. And I'll give you guys a moment to think about your answer. And the correct answer is 3. The LPN is the only one that can give medications between the LPN and the CNA, right? So number 3, giving that sub-Q insulin, which is a medication that LPN is going to do. The other choices the CNA freely can do, such as vital signs. In my first video, I explained what excuse me, when I say my first video, I'm talking about for the diabetes. I explained what the CNAs can do in relations to that, and CNAs, UAPs definitely can record and report. They can take the vital signs, they can record it down on a flow sheet, and they can report it to the nurse. Number two, checking the patient's glucose level before each meal. Absolutely. Unlicensed assistive personnel absolutely can do a glucose check. And number four, assisting the patient with morning care. That's ADLs. The UAP can do that. Okay, so number 15, we're moving on. A patient with type 1 diabetes reports feeling dizzy. What should the nurse do first? 1, check the patient's blood pressure. 2, give the patient some orange juice. 3, give the patient a morning dose of insulin. Or 4, use a glucometer to check the patient's glucose level. I'll give you guys a moment to think of your answer. And the correct answer is 4. The first thing that should be done is to assess the patient's glucose levels. Guys, remember in semester 1 of nursing, all that time ago, you guys learned about the nursing process and you learned about ADPIE. ADPIE. Assessment, diagnosis, planning, intervention, and evaluation. Okay, so the patient's feeling dizzy. We're pretty sure their blood sugar is low because that is a sign and symptom of hypoglycemia. They'll feel weak, they'll feel dizzy. But before you can intervene, which is the I, you have to do an A, which is assess. ADPIE, ADPIE. A, which is assessment, always comes before I, which is intervention. Before you do something for a patient, you have to assess them to know what you're going to do for the patient, right? Okay. So let's move on to number 16. While working in the diabetic clinic, you obtain this information about an 8-year-old with type 1 diabetes. Which finding is most important to address when planning child and parent education? 1, most recent hemoglobin A1C level of 7.8. 2, many questions about diet choices from the parents. 3, child participation in soccer practice after school 2 days a week. Or 4, morning preprandial glucose range of 55 to 70. I'll give you guys a moment to think of your answer. And the correct answer is 4. 4, that's the biggest problem we have at the moment, and that needs to be addressed, okay? Because that blood sugar of 55 to 70 is way too low. In the first video that I did in regards to diabetes, I explained to you that hypoglycemia, which means the blood sugar is way down, right? Hypoglycemia is way more dangerous than hyperglycemia, okay? And the normal range is 70 to 110. Some books say 74 to 110. And when I say 74 to 110 or 70 to 110, depending on which textbook you're using, that is fasting when the patient has not eaten yet. But that's 70 to 74. That is the lowest that the blood sugar should be, okay? But 55 to 70, that is way too low. And so a lot of education is going to have to happen with the parents to make sure that they understand that that blood sugar is too low. And sometimes some adjustment needs to be made, because since this is a type 1 diabetic, what does that mean? That means they're insulin dependent. That means they absolutely have to get insulin or they will die. They have to get an exogenous source. So sometimes when this happens, the doctor figures out, okay, well, you know, the insulin that the patient gets before they go to bed, it might be a little bit too much. Let's ease up on it. The doctor makes that decision, but your responsibility in regards to that is to recognize that this is abnormal and to do teaching. Thank you for joining.